Can you open the door, please?
Brooklyn's biggest hospital is flat out. An emergency room that's become a battle zone.
Did you guys do it up there?
Where there's a constant stream of COVID-19 casualties.
So we're now in the critical care area of the emergency department. Everyone that's in here today is here due to breathing problems, almost uniformly all from COVID. We're seeing such a large increase on a day-to-day basis on the number of patients who are presenting in critical condition, requiring really all the resources that we have to provide in order to help them.
Dr. Eitan Dickman says there are normally 17 beds in this room at Maimonides Medical Centre. Today, there are 32 patients, and the numbers are rising rapidly every hour.
We have opened up new ICUs, new intensive care units. We've opened up new medical units in order to accommodate for this increased demand of patients who are coming in so ill.
In a city of extremes, this pandemic has been a painful equalizer.
This is an intense, demanding and desperate atmosphere in here. The patients keep coming. And it's not just the elderly, it's the young too. And they're all struggling.
It's a daunting new frontier for medics, even for the most experienced.
We're obviously seeing a large number of critically ill patients.
Yeah, I've seen some of the sickest patients I've ever seen in my whole career. Not only do they have coronavirus, but they also have their diabetes that's out of control. So it's particularly hard, and we're learning how to do it, how to manage.
It's a brutal learning curve and an often unforgiving fight for those with existing health conditions.
Really the main effect that we're seeing is a significant effect on impairing the lungs' ability to provide the oxygen that the body needs, and then it spreads. It affects the heart, it affects the kidney, ultimately, unfortunately, oftentimes taking the ultimate toll.
Elsewhere in New York, there's a dire lack of personal protective equipment for frontline medical staff. Some are so desperate they're making their own. Maimonides was well prepared and well organised, but they haven't faced the apex of this virus yet.
How concerned are you about the days, the weeks and months ahead?
I think we're in for a significant period of seeing a lot of very, very ill patients, and this is going to put a strain on the system. We want to make sure that we have enough supplies, including PPE for the staff, including ventilators, high-flow oxygen devices. At this time, we do have sufficient supplies, but that's something that we're monitoring very, very closely.
Their work has spilled onto the streets. Triage tents at the front to tend to the living. Refrigerator trucks at the back to carry the dead. But here, brave doctors and nurses are working every minute, risking their lives so they can save others. Cordelia Lynch, Sky News, New York.